Hello, we are live, and in today's live stream, I will be talking about what exactly illimitable band friction rub syndrome is. If you're new here on our channel, please turn on the live stream notification and subscribe to our channel so that you get notified each time we publish any new video or go live. My name is Ishan Arora from PriMovers. I'm a physical therapist and have been helping people with aches and pain and injuries for more than 13 years now. In this today's live stream, I will be talking about one of the most common knee pain condition, which affects mainly the runners, hikers, and cyclists. But it can happen to anyone who spends a lot of time on their feet. So, especially if you're running or walking quite a lot, there are good chances that you can develop irritable band friction syndrome. So, let's dive in and understand what exactly irritable band friction syndrome is. Okay, to help you understand what exactly irritable band friction syndrome is, so let me take you through the skeleton and let's understand what this irritable band is, what exactly happening, and why do you get and start developing the pain on the outer side of the knee in this case. So, as the name suggests, irritable band friction rub syndrome usually affects one of the band which is there on the outer side of the knee called iliotibial band. Now, as you can see here, this is called the iliotibial band. Iliotibial band is an extension of two muscles. So, one muscle is there on the outer front thigh called the tensor fasciae latae, and the other muscle is there on the buttock muscle called the gluteus maximus muscle. These two muscles combine on the outer upper thigh to give an extension in the form of band, which is a thick fibrous connective tissue, and this is called IT band. The main function of IT band is to reduce any compressive and tensile forces that are coming on the outer side of the knee, and it also helps in stabilizing the knee from the outer side. But what happens is when the load increases on this IT band because of various reasons, which I'll explain you just now in a few minutes, this IT band is not able to take the load and it starts causing a lot of pressure on the outer side of the knee along with the tightness and can develop into pain and inflammation. So let's understand what exactly happening in this case. What are the symptoms of irritable band friction syndrome? What are the causes that really leads to irritable band friction syndrome? And what are the best treatment solutions out there for you to start working on for the best long-term solution? Okay. So again, if you are watching this live stream live, so let me know in the comment box below by typing live, or if you're watching it on replay, let me know by typing replays. And if you have any questions about irritable band friction syndrome or any other question, do let me know in the comment box below. I'll be more than happy to answer your question as soon as the live is over. So let's dive in and get back to irritable band friction syndrome. Now, irritable band, again, as I said, is an extension of two muscles. One muscle is right here, the other muscle is in the butt called the gluteus maximus muscle. Both these muscles combine on the outer upper thigh to give an extension of this band. Now, as you can see here, the attachment of IT band on the lower side is attached to the part of your leg bone called the tibia. This bone is called tibia. The outer part of the tibia is where the IT band inserts or attaches. And what happens is when the IT band becomes too tight and stiff, it starts to pull this side of attachment, and that's where the pain starts to build up. The pain is right on the outer side of the knee joint line or slightly above the outer knee joint line. So you tend to see the inflammation, swelling, pain, tenderness around this area. The moment you place your finger, you touch on this spot, you feel the pain on the outer side of the knee. And if you're a cyclist, runner, or hiker, you would have seen and you would have known this condition and term. So this is one of the most common thing which happens to cyclists, runners, and hikers. But it can happen to anyone who spend a lot of time on the feet, whether they are walking, running. It can happen to anyone. And let's understand what are the causes for it, and what are the symptoms, what kind of symptoms you feel with the irritable band friction syndrome, and what are the causes which leads to the irritable band friction syndrome. Now, the first and one of the most common reason, the symptom. Let's go back to the symptom. Sorry. Okay. And the symptoms of irritable band friction rub syndrome, as I said, you see the swelling on the outer side of the knee joint line along with the inflammation. You can you can feel the pain on the outer side, which is called the lateral knee pain. You can also feel the clicking and popping sensation coming from the outer side of the knee when you're walking, and especially when you're walking downhill, you will feel the snapping or clicking sensation. That is basically happens because of the tightness of the IT band. And you can feel that the pain is getting worse when you start doing the activity. For example, you do the activity, the pain gets worse, especially running on the outer side. Again, there are good chances that you have the IT band friction syndrome. Or if your pain is getting worse, especially when you're going for downhill climbing, downhill running or downhill walking, your pain is increasing on the outer side of the knee, then again there are good chances that you have the IT band friction syndrome. You feel the pain, you feel the tightness or a feeling of heaviness is there on the outer side of the knee in case of elutable band friction lobe syndrome. So that's why it's important to understand what are the symptoms of elutable band friction lobe syndrome, so that you can differentiate your symptoms from the other condition. For example, if you have other condition but the symptoms are what I just mentioned here, then you can correlate, okay, and you can maybe make out and have the impression that the symptoms what you have could be coming from the condition called the elutable band friction syndrome. Now let's understand what are the root causes for irritable band friction syndrome. And to explain you this further, I'll take you to the skeleton so that I can explain you each and every cause properly and in detail. So one of the most common reason for the cause for irritable band friction syndrome is the overuse or repetitive activity. So for example, if you run, or if you keep doing the cycling, or if you're going for hiking, but without recovering the body, especially the lower body, or without recovering the muscles, the joints and all that, so there are good chances that you are perpetually increasing the load on the IT band, and eventually the pain can come on the outer side of the thigh and the knee. The second most common reason is if you have the imbalance in the muscle and in the joints. So let me take you on the skeleton and explain you what exactly I mean by that. Now, okay, the first and the foremost imbalance that we get to see is like if you have the lack of mobility on the joints. Okay, so if So as you can see here, these are the joints. So we have the hip joint. Hip joint is made by your two bones called the pelvic bone, which is the hip bone, and the thigh bone. These two bones make a joint right here. This is called the hip joint. This is the hip joint. This is the knee joint, and we have the ankle joint lower down here, and this is your ankle joint. If these three joints are not moving enough, so what I mean by moving enough is if the mobility in these joints is not good enough, there are good chances that you will have increased load on the muscles which are above it. Okay, the muscles which are supporting the joint will be very tight and heavy if the underlying joint is very stiff and tight. So very very important, this is one of the most common reason, because most of the time we don't realize that we need to work on the joint, and we start working on the muscles straight away. Again, in that case you see the partial result, you don't see 100% improvement. So the first, the joint is called, if your hip joint is not mobile enough, that means if hip joint is not moving forward, which is called the forward flexion of the hip, or not extending enough, or not rotating inside outside, which is called the internal and external range rotations of the hip. If these are limited along with the forward flexion and backward extension, then there are good chances that you will have increased load on the IT band. And the second is like if your knee joint and ankle joint are not mobile enough, you tend to feel the symptoms of heaviness building up in the IT band. And again, this is one of the cause. If you fix the cause, that's where the result is. You start feeling the improvement. Okay, so we'll come to the treatment part separately as well. Okay, now the next one we have are the muscles. So muscle imbalances. Now muscle imbalance can happen in various form. The muscle imbalance can happen if your muscles are very very tight. So again, as I said, if the joint is tight, the muscles are overlying muscles are tight, then you tend to feel the pressure building up on the IT band. If all your thigh muscles are very tight and your front hip muscles are tight, that increase the load on the IT band. If your TFL is tight, if your butt muscles are tight, so all these are building up the load on the IT band. Okay, so very very important that we work on reducing the underlying cause. We start working on the underlying cause to fix it for the long term. Very very important. Now again, the muscle imbalance can happen in the form of weakness as well. So if your muscles are weak and you spend doing some activity which you're not strong for, then there are chances that you can increase the load on the IT band. So for example, if you're not a regular runner and your leg muscles are weak, and all of a sudden you start running, there are good chances that you will build up the pressure, or you will start building up the tension in the lower body, and eventually the pain will build up in the IT band as well. That can possibly increase the pain on the IT band. Now let me take you back on the second most common. The most common second cause for the third most common common reason for the IIT band friction syndrome is the training error. So if you increase your training intensity too much too soon, and for example, if you're not running earlier and you start running all of a sudden without doing the warm up, cool down, or instead of slowing gradually, preparing yourself for running, you all of a sudden start running right away with increased intensity. There are good chance that you may develop the pain on the IT band and increase the load on the IT band. Okay, if there are other biomechanical factors such as like if your foot is rolling quite a bit inside and outside, when it rolls quite a bit inside it's called the overpronation. When it is rolling outside quite a lot, it's called the supinating, high over supinating foot or the supinating foot. Okay, now when you walk and when you do the heel strike, your body weight comes, your foot goes slightly inside. This is called the normal pronation. But if it happens over and above the normal pronation, it's called the overpronation. Or if it is not moving enough, it's called if the normal pronation is also not happening, it's called the underpronation. So it's very important that you get yourself examined for this, because we don't know if your foot is rolling quite a bit inside. No matter how much you're working in terms of treatment, but you're not fixing this biomechanical factor, you will not see the improvement in the IT band friction syndrome. So it's very important to understand what is the root cause for it. But once you start working on the root cause, you start seeing the result as well. If you have any kind of leg length discrepancy, so if your leg length is shorter or longer, if your one side is shorter than the other, again you can develop the IT band friction syndrome. Now LLD, which is leg length discrepancy, can be of two types. So one could be functional leg length discrepancy, and other could be the true length discrepancy. The true length leg length discrepancy usually happens during birth or around like the birth time, where you have the true bone to bone length discrepancy. The bone to bone, there are difference, right versus left. One side is longer than the other from birth. Or the other possible reason, if you have the functional leg length discrepancy, which happens usually because of the weakness and tightness of some body parts. So if some part is weaker or tighter, one side can be little longer than the other one. Okay, so but this can be corrected. Both can be corrected, like, but the treatment of correction is different in both the cases. The second last point here is if you have the poor footwear. So if you're wearing the wrong footwear, your footwear doesn't provide enough cushioning or doesn't support on the outer side, on the inside. Again, when I'm talking about the pronation, overpronation, or supination, okay, if your footwear is not providing enough support and cushioning, there are good chances that you can increase the load on the IT band, and eventually the IT band pain can increase. The last but not the least is if you have the previous history of injury. So if you had previous history of injury or any injury in the past and you haven't recovered from that, or if you have recovered from that partially, in both the cases, there are chances that the load that you had on the IT band is a lot more, and eventually the pain can be there on the IT band. Okay, so that's why it's important to understand. You work on all this root risk factors and also the causes. Once you start working on it, there are good chances that you will start fixing the IT band for the long term. Okay, to help you understand further, let me take you to the skeleton again. Now what exactly this overpronation is. Now as you can see here, now overpronation is like when your foot is rolling quite a bit inside. Okay, now when you walk, when you have the body weight coming when you're walking, the normal pronation happens. This is called the normal pronation. Okay, but when it happens quite a lot, then it's called the overpronation. When your overpronation happens, uh, then your it doesn't stay just at the level of ankle, so it happens higher up as well. And okay, so let me just show you once. So again, if the overpronation is happening, so if it is happening like this here, then the leg rotation inside is also quite a lot. Okay, your leg is going for a rotation and torsion is quite a lot. Then your thigh bone internal rotation is also quite a lot, and this also increases the good amount of load on this IT band. Okay, versus again, if you have the flat foot, same thing happens. Your foot is quite going quite a bit inside, your leg goes inside and your thigh bone goes inside when you put the body weight on the foot. This is what happening. And then the shoe that you're wearing is also not providing enough cushion on the inner side. No, you're not wearing the right shoe, so it does not justify the purpose. Now what it does is increases the load on the IT band, other structures on the thigh and the hip area. Okay, or The other scenario is if your foot is not having the normal pronation, where your foot is normal, not going for normal pronation, which is a little bit of pronation, and instead it stays more straight, does not go inside, or it stays more outside, where when you put your body weight on this, and instead of having the foot going slightly inside, your foot stays out, and this is called the supinating foot, or the over supination or supination, where the bones also roll out and thigh bone rolls out. When this is happening, typically what's happening is the outer rotation of the hip or the thigh bone has increased. And what I mean by that is your load on the outer front thigh will increase, so does on the IT band, so does on the outer hip structures, outer thigh, outer back thigh. All the structures are going to be tight, so eventually the load on the IT band increase, the pain will be more on the IT band. So these are the biomechanical factors, and why we need to understand this properly, because we don't understand this properly, there are good chances that you will not be able to fix the IT band 100%. And if you fix it, the solution is not going to be 100%. Okay. Now let's go back and understand what are the treatment options available in case of the IT band here. Now again, IT band, as you can see here, the main treatment option for the irritable band friction nerve syndrome is the physical therapy. Now, what physiotherapy or physical therapy includes? Physical therapy, again, as I said, when you have the first aid for irritable band is the moment you start feeling it, you start doing following things. The first thing is you rest your IT band. That means the activities that are increasing the load on the IT band. As soon as you find out, okay, now this is the activity which is increasing the pain, especially if you are if you're going for downhill walking or running, and usually that is one of the most common reason for pain on the IT band. If you're going for uphill and downhill running, walking, that increase the load on the IT band. So stop doing that and reduce if you can as much as possible. And the second is like you provide the rest to the IT band. And when I use the term rest, I'm not saying you need to lie down on the bed and rest. You need to do the active rest. You need to offload the IT band from the stress or the activities which are increasing the load, and do the things which are not increasing the load, or do the exercises or other things which are not increasing the load but help you recover from the irritable band friction syndrome. Okay, so start doing that. That's called the rest. It's active rest here. Ice pack compression. Now, since I mentioned like the irritable band friction nerve syndrome causes the inflammation and pain on the outer side of the knee, the first aid that you need to start doing it is you need to start putting the ice pack on that area, at least for 7 to 10 minutes, 2 to 3 times a day minimum, to help reduce the inflammation which is building up around that area. One over and above that, you need to start working on the treatment part, the rehab part, which will start fixing the root cause of the problem which led to the IT band on a long run. Okay, and you can also do the compression of that area. So you can do the compression bandage in the form of crib bandage, or you can put the kneecap, or the basically the kneecap, knee support, or the knee brace, which provides you support on the lateral side, on the outer side, which helps in providing the stability on the outer side, and also reduce the load on the outer side of the knee. Okay, so start wearing it. Now, what is physical therapy in case of irritable band friction nerve syndrome? Now, physiotherapy or physical therapy helps in really evaluating the root cause of a problem. So, since I mentioned number of causes for irritable band friction nerve syndrome, right? So, with the physical therapy, you get to know what is exactly the root cause of irritable band friction syndrome in your case. Now, once you find out the root cause, it becomes so much easier to treat the irritable band friction syndrome. Okay. Now, again, whether it's a repetitive stress that you can make out, if you're doing the repetitive stress on the IT band, or you're running quite a lot, try to reduce that, helps you offload the pressure. And again, the physical therapy helps you examine the root cause, whether it's a limited hip joint mobility, knee joint mobility, or the ankle mobility, which is causing the increased load on the IT band. Is it the lack of flexibility in the muscles around the hip, knee, ankle, which is increasing the load on the IT band, or is it the lack of endurance and strength in the muscles in the lower body, which is increasing the load on the IT band? This you get to know with the physical therapy. The physical therapist help you examine that. And again, if you know the basic parameters of examining, you can self examine as well with certain tests that we usually provide in our program, and you can do that on your own, and you can let us know what's causing the pain, what activity is causing the pain. And if you let us know the activities that we give you, and you can tell us what activity is causing the pain, and what is limiting your motion in the lower body in terms of mobility, flexibility, and the strength, then it becomes so much easier. So again, the physical therapist help you examine whether it's a mobility issue or the flexibility issue or the strength issue, and based on what is causing the problem, we can start addressing the issue of irritable band, and you can fix the problem for the long term as well. Is it the poor support or the poor footwear you're wearing? Either okay, or are you wearing the footwear which is not supporting your foot enough, or if you have any previous injuries, so which with that program we help you recover from the previous injury as well, so that you're focusing on fixing all the things not together, but again you're making sure that you're working out separately on all the things to help you reach 100% of improvement. Okay, so very very important that again, so that's how you treat irritable band friction nerve syndrome. Is first we need to rule out what exactly the limiting motion, whether it's a mobility issue around the hip knee ankle area which is causing the pain, whether it's the lack of mobility, lack of flexibility, or endurance and strength issue. So once we start really evaluating that, you can fix the pain for the irritable band for long term. Again, I'm going a little fast. If you have any questions, do let me know in the comment box below. If you have any questions in general about any pain, that also you can let us know, so that when we go live next time, we can cover up your topics, and we can provide answer to your questions. Okay. Now, what do we do here at PriMovers? PriMovers is an online pain and performance rehab solution platform where we provide injury prevention programs to you, help you recover. Like the programs are designed for you for 8 weeks, 12 weeks, so that you start working on the root cause of your problem, and slowly and gradually you can fix it for the long term, and you realize what are the things which you need to be working on, and you fix it for the long term here. Okay. Now again, as I said, you can let me know your comment questions below. Now we work at usually fixing the problem from the root, and for that we work at 5 levels of fitness. The first one is we try to improve the mobility of all the joints surrounding the area which is in pain. Okay, we try to improve your mobility. The first thing we start working on is improving the mobility of, especially in case of IT band, we start improving the mobility of the hip knee ankle area. And once that is getting better, along with that we start you with a flexibility program where you start tackling and working on the stiffness in the muscles, the inflexibility issues in the muscles. Once you start fixing that, along with that we put you on the stability program where you start stabilizing your hip knee ankle area, because that gets compromised if you have a little bit band friction nerve syndrome. Then over and above that, the program will have the endurance program where you start working and increase basically lifting and working with the load or the weights with a lot more repetitions. You're not putting the load too much too soon on the body. What you do is you put up the slight load, but you try to do a lot more reps, because doing a lot more reps is far more easier and more controlled than doing more heavy weight like running. So when you run, you run with your entire body weight, right? So when you start lifting the weights, you start doing the exercise, you start with the lightweight. Once the endurance is done, we slowly and gradually push you for the strength part, where you start working on the strength of the muscles, and you start building up the strength of all the weaker muscle groups. So that's where the examination comes in, and that's where we tell you, and that's where you get to know what are the weaker areas of the body. Once you know the weaker areas of the body in terms of muscles, you start working on those muscles first, so that you have the better foundation of treating the injury. You're not working randomly on any muscle to strengthen. You need to know what all muscles are weaker for you, and once you start working on the weaker muscle groups first, that basically builds a better foundation for you. You can build the foundation over and above that, and you can make yourself really strong and come out of this irritable band friction nerve syndrome faster. Okay, I hope this is clear, and if you have any doubts, any questions, put that in the comment box below. I'll be more than happy to answer your question. Now, what you can do best right now is we have a program for you. It's a free program of irritable band that will get you started fixing the irritable band friction or syndrome. And for that, all you can do is you can go, there is a link in the description of this live stream. You can go there and check the link and download your free guide along with a free exercise program for irritable band friction or syndrome. And thank you so much for joining the live stream and staying till the end of this live stream. If you have any questions, do let me know in the comment box below, or if you feel like I haven't answered something that you would want to mention, you can also put that in the comment box below. So that's really it for this live stream. And thank you so much, and have a great day. I'll see you in the next live stream, which I will be doing the coming Monday. Okay, I will be going live at 6 p.m. coming Monday as well. So you can let me know in the comment box below if you have any questions, or if you have any topic in mind that you would want me to cover. I'll be covering that topic for you in the next live stream. Thank you so much.